Hi, my name is Danielle LeVeck and I am here with BoardVitals to go over some NCLEX review questions. Which of the following complications would be most likely to occur following a cardioversion? A stroke, B, hypertension, C, nausea and vomiting, D, urinary incontinence. So the answer to this question is a stroke. If the patient has been in atrial fibrillation for over 48 hours, or you don't know how long the patient has been in atrial fibrillation, a clot can form in the patient's atrium. And when the patient's shocked for cardioversion, it can release a clot from the heart that will travel up to the brain and cause a stroke. So typically, as far as the other answers, would be more likely to have hypotension after a patient is cardioverted just because of arrhythmias, but definitely not hypertension. And nausea, vomiting, and urinary incontinence are not typical complications of cardioversion. Thanks for joining me. My name is Danielle LeVeck, and I hope you join me again for NCLEX review questions with BoardVitals.